Potential discussion topics, common misconceptions about our cardiovascular health, to be scheduled at a future Palm Beach Columbia Alumni Association meeting. If you are overweight or obese and want to be skinny, there is an approach that has worked for 2 million years. If you want to have a longer sex life, avoid premature impotence, lower your particle number, the real surrogate for atherosclerosis, to less than 1,000 as early in life as possible, and then keep it there. If you want to live a longer, uneventful, and more satisfying life, lower cardiovascular risk factors, more specifically, prevent abnormal cholesterol, lipoproteins from accumulating in the body cells, which is the cause of early cell death, also known as apoptosis, and is the cause of more rapid aging. Where does weight control, exercise, and healthy lifestyle fit into the complete picture? My answer is look at the 4 million cardiovascular events per year, which is a 2.5% yearly event rate for 160 million eligible candidates. Over one's expected 50-year adult lifetime, well over 80% of us will be afflicted. For one reason or another, therapeutic lifestyle is just not working. If you think that only overweight or obese people suffer from vascular disease, then consider this. The greatest mortality rate from coronary artery disease epidemic occurred in the late 1960s when the obesity epidemic did not exist. Yet many of our medical experts and news media claim the excessive incidence of coronary artery disease is due to the obesity epidemic of the last 30 to 40 years. Today, 60 to 70% of our population is obese or overweight, and obesity epidemic is unbelievably spreading to China and Japan, an astounding increase from my youth. You may ask, why is that? The answer is the globalization of the Western diet. Putative experts and the media believe it is because we eat too many fatty foods, fail to exercise, and in general cannot control our gluttonous and voracious appetites. Yet, today, the truth is that we consume, at the exhortation of multiple media advertisements sponsored by the beverage and agricultural industry, well over 10 times the carbohydrates of our ancestors. Our obesity epidemic is directly attributable to this increase in the amount of refined carbohydrates and starches, that is, carbohydrates, along with relatively recent high fructose corn syrup that we consume compared to 30 to 40 years ago, with the resulting hormonal imbalance caused by them. These carbohydrates are directly related to processed foods, the introduction of high fructose corn syrup, and the recommendations of the USDA, whose food pyramid has recommended that we should be consuming relatively more carbohydrates, 50 to 60%, than fats. Yes, indeed, the decrease in fats from most of our diets and the substitution of carbohydrates and processed foods has resulted in our and now the world's diabetes epidemic. How most are really spending their medical dollar. Excluding the years before 40 and after 65, depending upon weight, the average monthly premium for non-pre-existing condition, non-Medicare patients in the United States is $800 to $1,200 per month. The range is from $10,000 to $15,000 for premiums per year, and over 25 years is $250,000 to $375,000 for a clean medical record. Wow! Our high medical premiums are paying for all those who are already ill, or into the future those that are neglectful, with very little allocated to the supposedly healthy. If you should have a cardiac event, your insurance premium will accelerate to $24,000 to $26,500 per year, and possibly a total of $660,000 for that similar 25-year period. Would you like to think about the cost of the years prior to 40 or the years after 65, both of which will require additional years of coverage, and if Congress has its way, may not include Medicare for the elderly? These prices usually do not include the usual medication programs such as Medicare Part D. They do not include your copays for future frequently indicated advanced diagnostic cardiac imaging technologies such as nuclear and CAT scan angiography, whose downside includes radiation and cancer exposure. They do not include copays for echocardiography or now the extremely expensive MRA studies. They do not include your ever-increasing yearly deductibles. they do not include the present 9% inflation rate per year. The medical insurance main goal is to contain costs, however achieve to maintain greater profits. Now, if you are one of the individuals who could spend thousands of dollars on investments and is reluctant to risk spending a one-time $500 fee to diagnose and $1,500 to prevent a disease that has a high 80% probability of afflicting you in your lifetime and could eventually cost you millions, then be my guest. If you think that, like that old Fram filter advertisement of years ago when they said, "Pay me now or pay me later," that is to the hospital industrial complex, coronary interventionalist, vascular, or cardiac surgeon, is inaccurate, just review the previously provided statistics or attend my future presentation. Overall, our medical insurance system has a penny-wise and pound-foolish approach for societal needs, but a very popular one for hospitals and their vendors as well as pharmaceutical companies and sometimes interventionalists. How to avoid the exorbitant costs of the medical insurance companies, the hospital industrial medical complex, imaging vendors, and the pharmaceutical industry. Become a convert to proactive cardiovascular disease prevention.